Liquid biopsy is a powerful technique that can be applied to different stages of cancer screening and treatment. Screening and early diagnosis. Liquid biopsy can be used to identify cancer patients in the asymptomatic population, allowing for earlier diagnosis and better intervention. To be able to use liquid biopsies for cancer screening, the analyses would have to be sensitive enough to detect when the tumor is releasing cancer cells. For example, the process of cancer development from in situ to invasive disease could be associated with the activation of innate immunity, and such changes might be detected in the blood before they show up on an imaging scan. Another possibility of cancer detection could be the identification of products of tumor metabolism related to the cancer. Treatment selection and prognosis. The detection of circulating tumor cells, CTCs, and cell-free DNA, cfDNA, can also be used to select treatment and assess disease prognosis. Studies have demonstrated that in addition to the detection of mutations in cfDNA, the number of CTC at baseline and throughout treatment can be predictive of clinical outcomes. For example, ctDNA sequencing enables tumor-specific molecular profile of patients to guide targeted therapy for precision medicine. The half-life of cfDNA in the circulation is between 16 minutes and 2.5 hours. That is why ctDNA can be considered real-time snapshot to reflect the overall evolution of lesions. This enables real-time and long-term monitoring of the treatment effect, allowing feasible treatment adjustment and better prognosis. Also, ctDNA facilitates dynamic monitoring of the clonal evolution and helps to identify the emergence of resistant subclones. In patients treated with immune checkpoint inhibitors for NSCLC, for example, ctDNA has been shown to be an early marker of therapeutic efficacy and could better predict survival outcomes. Residual disease, resistance, and risk of relapse. Liquid biopsies can be used to predict drug response and drug resistance in patients initiating a targeted therapy. One major advantage of liquid biopsies is the ability to obtain serial blood samples for cell-free DNA, ctDNA, analysis, which provides the opportunity to examine molecular changes during therapy with the hope of detecting drug resistance before seeing radiographic evidence of disease progression. Even after treatment is deemed successful, relapse is still a significant threat to many cancer patients, and it is hard to detect the residual disease in time using imaging or tissue biopsy. Very few effective and reliable markers are available currently. Recent research demonstrated that ctDNA assays could detect residual disease several weeks earlier than radiologic imaging, and ctDNA-positive patients were at higher risk of relapse and exhibited worse outcome, like shorter overall survival and disease-free survival time compared to the ctDNA-negative patients. In summary, liquid biopsy applications in cancer treatment include early detection, differential diagnosis, tumor burden evaluation, progress assessment, minimal residual disease detection, recurrence prediction, and therapy responses monitoring.